Welcome back. Here's a surprising fact. Men face twice the risk of heart attacks compared to women, and they're also diagnosed with heart disease nearly a decade earlier. But 80% of the time, heart disease is preventable. So let's talk about how to be smart when it comes to your heart. There are a lot of factors that can keep a heart healthy. What are some of them?
Well, it's usually what I call the boring stuff, you know, controlling your weight, exercise, healthy diet, like not smoking. It's not exciting stuff, but it's really the way to go.
What about the numbers? Blood pressure, cholesterol, sugars? What should people know?
So blood pressure you want to keep below 140, the top number, systolic, over 90, diastolic. When you look at the risks associated with high blood pressure, the biggest concerns come with elevated diastolic pressure, so the number on the bottom, because that tells us a lot about vascular tone. That tells us about how stiff the blood vessels are. The stiffer the blood vessels, the higher your risk of heart attack, stroke, and other vascular problems. Cholesterol is funny that way. Cholesterol is a moving target. His cholesterol number and your cholesterol number as individuals who maybe don't have heart disease, your targets are going to be different than someone's targets who already have established heart disease, because in those individuals we recognize that as cholesterol gets higher and higher, the risk starts to go up exponentially. So really, in someone who has established cardiovascular disease, so previous stroke, previous heart attack, there is no real floor. We shoot for an LDL, a bad cholesterol number of less than 1.8 millimoles per liter. But what we try to do is get you down as low as you can and help you engage in the lifestyle changes to keep you there.
Considering the demanding pace of modern life, Eric, there's no question men and women alike face high-stress situations. What's the connection between stress and heart health?
I mean, I'm not exactly sure what the connection is, but things that they can do, you know, to just get them to calm down or relax, particularly with men. The most important thing is connecting with other people, right? That will just settle their system down, which sounds so simple, but sometimes picking up a phone and reaching out will really help. And then there's basic things like a little bit of meditation, which, you know, now is a little bit more in vogue, but trying to get men to really think about, hey, how do I relax my physiological system? And so I think those things are really important to do.
For what it's worth, the relaxation piece is important, because with big stress comes spikes in blood pressure. And when you get spikes in blood pressure, that's what actually drives acute events, right? When people have heart attacks, it's because a blockage in one of the arteries of the heart might become unstable. And a common reason for that is because you have a spike in your blood pressure, either in the setting of stress or in the setting of a natural rise in your blood pressure, often in the middle of the night when you sometimes wake up with a start. So it's worthwhile recognizing that stress not only leaves us unable to take care of the risk factors that develop cardiovascular disease, right? They turn us towards things like smoking, drinking, overeating.
Yeah.
But they also drive blood pressure spikes. And blood pressure spikes are really what destabilize an otherwise stable situation.
Cardiac arrest and heart attacks are two different things, so they often tend to be used interchangeably. What's the difference?
So cardiac arrest just broadly describes when the heart stops, okay? When the heartbeat suddenly goes to either a dangerous heart rhythm that can't generate enough blood to go to the body, or where the heartbeat just stops completely. That can happen because of a heart attack, so because of coronary heart disease. But there are a lot of other reasons where the heart can suddenly stop beating as well. Most commonly amongst them is a primary problem with the heart's electrical system. That's why a lot of people get pacemakers. Sometimes it's because of a dangerous heart rhythm where the beating of the heart becomes uncoordinated, and as a result, the heart isn't able to move enough blood into the body to supply the body. That, though not truly an arrest or stop of function, is a severe enough dysfunction that effectively to the body it means the same thing.
Can prostate problems affect the heart?
I don't know directly, but I would say just in the context of men's health, you know, one of the issues is that men are putting off seeking attention, whether it's for urinary symptoms or for their heart. And that's one of these major events is what brings them in. One of the reasons why urologists have sort of have the secondary title as the men's health doctor is because a lot of men aren't going to come in until they have a problem peeing. And that's why they're going to come in to see a doctor maybe for the first time since they were a teenager. Another major thing may be a heart attack or a stroke, there's something major that brings them into the hospital in the emergency department because, again, they'd be neglecting going in for their routine checkups.
You know, it's not uncommon that we'll have patients who have heart disease who come into the office to see a cardiologist after an event, but they've been taking therapy for erectile dysfunction for a long time. And now we have to put them on additional medications that sometimes interact with the medications they take for their erectile dysfunction. They've been told that by their pharmacist. And that's what clues them in to say, I need to get my erectile dysfunction checked out as well because now my medications don't agree with one another and the nitrates that I'm going to need to control my chest pain are going to put my blood pressure at dangerous risk of dropping if I end up taking my Viagra.
Well, and speaking of medications, I am curious because I have read, we've heard a lot about Ozempic in the news lately as a weight loss drug being used by celebrities. It's a diabetes drug. But apparently there's some relationship to your heart. It could be potentially good for your heart. Have you heard that?
Yeah, there's a couple of different studies that are in the literature that have been released relatively recently. There was a sort of top-line news study that came out recently from a group in the United States called the SELECT trial, where about 17,000 patients were looked at from the perspective of reductions in the risk to their heart. These were all patients who had established cardiovascular disease and who had some component of obesity. And what they found was that it reduced the risk of a major cardiovascular adverse event, so heart attack, stroke, peripheral vascular disease event, by 20%. 1 in 5, which is in clinical study terms, a huge hit. The other place that Ozempic seems to be making waves is in the treatment of a syndrome called heart failure. Heart failure is a catch-all term that describes when people get short of breath when doing activity. There are 2 major flavors, one where the heart pumping function is the problem, another one where the heart's relaxation function is the problem. In both, the problem is that pressures in the heart go up very quickly, they back up into the lungs, and people become short of breath. In patients who have heart failure with preserved ejection fraction, so when their heart pumping functions normal, but the relaxation functions, broadly speaking, abnormal, a trial that recently came out called STEP-HFpEF demonstrated that these individuals actually have a big improvement in their quality of life. So they can walk further, they get short of breath less, and they lose more weight with Ozempic. And it seems as though the effect goes beyond just the weight loss.
That's fascinating.
So there's really fascinating things about this drug. It's new, we still have a lot to learn about it, but that's the beauty of working at centers like the Peter Munk Cardiac Center, right? Where research is key, and we try to unravel these questions, the answers to these questions.
It is so true. We need to take a quick break, and when we return, a topic that is as important as it is uncomfortable: mental health. That's next.